This is our policy presentation on our policy of certified peer support in mental health and or addiction treatment. And then today we're going to be talking about our policy summary, implementation process, differing perspectives, policy alignment with the NASW Social Work Code of Ethics, and then our prepared questions.
The main goal of the policy is to help people improve their recovering by providing those in need with people who have lived experiences similar to their situation. The certified peer supporters indicate that they have completed and been certified as a certified peer recovery supporter, certified youth peer supporter, or a certified family peer supporter. 49 states and DC have certified peer support systems, and these began to become widespread in America when peer support services became recognized and covered by Medicaid. Some ways that peer specialists assist their clients are by building relationships with them, sharing like minded experiences, mentoring, and helping them set goals and helping them navigate the healthcare system. People can access help from the policy through their healthcare provider or local treatment facility or organizations.
How the policy is implemented. It requires a lot of training and integration in healthcare and guidelines. So training to be a part of this usually requires an exam over training on principles and ethics from government standards. And many are employed in hospitals and recovery centers, while some states allow services under Medicaid. Ethics is involved in this because it helps maintain confidentiality with patients and professional boundaries. Some states provide funding for the policy through programs and nonprofits, and legislation is pushing for access to more peer support treatments.
So for the differing perspectives, one would be the benefits of peer support groups in the treatment of addiction. So this discusses the benefits of peer support groups and ties with addiction recovery. It shows that these groups have shown promising results in enhancing recovery outcomes. The article reviews different studies that show benefits of areas like treatment engagement and reducing.
The NSAW Code of Ethics displays the code of ethics for all workers to follow. The code helps social workers handle unprecedented situations and helps them follow a standard of how workplaces should be conducted. This code also helps social workers when dealing with people's mental health and or addiction treatments. The values of the code of ethics should be the same as the ethics held by the social workers mentoring peers when dealing with these situations.
Um, the perspective from the article examines Donald Trump's motives behind his presidential election, and whether it was rejection or the social status or reaction from the changes.
Hotel California by the Sea Cincinnati Rehab Program provides treatments and help for people struggling with substance abuse. They include specialized treatments based on your needs and give you support. They also offer dual diagnosis for individuals facing multiple mental health disorders, and they have many different services and have a more personalized approach to treatment.
Our policy both relates and doesn't relate to the NSAW Code of Ethics, but it relates by the commitment to clients and the integrity and professional boundaries. For the commitment to clients, the NSAW Code of Ethics emphasizes service and the importance of human relationship, and the integrity and professional boundaries. The NSAW stresses avoiding conflicts of interest and not engaging in situations where these events could happen or impair their objectivity. And it doesn't relate to the code of ethics with their dual relationships. The peer support allows for more flexibility in relationships, which includes friendships or mutual support. and the experience versus training. The social workers usually rely on academic training and their professional experiences.
And then we have the prepared questions. The first is, are there any other groups which you believe could benefit from certified peer support? What groups and why? And do you believe certified peer support is effective? Could you see yourself benefiting from certified peer support? Why or why not? Thank you for listening.